Welcome to Dr. Amanda Clarke, Heart Health and Cardiology. Nobody told you that the number your doctor circled on your last blood test, the one they called borderline or something to watch, is quietly building a wall inside your arteries right now. Not a wall you can feel. Not a wall that hurts. A wall made of fat and calcium and inflammation that has been forming since your 30s, and that by the time it becomes a problem, will have been growing for decades while you felt completely fine. And nobody told you that there are specific, proven, research-backed things you can do in the next 30 days that will begin to dismantle that wall. Without a prescription, without a gym membership you will not use, without giving up every food you enjoy, starting from your kitchen. Starting this week, today I want to give you exactly that. Not the watered-down version that tells you to eat less fat and exercise more. The specific, mechanism, level understanding of what cholesterol actually is. What the numbers on your test actually mean under the updated 2026 guidelines, and what the research now shows can move those numbers in the right direction, within 30 days for most people who apply it consistently. Here is the number that most Americans with high cholesterol have never been told in a way that made them understand its urgency. Nearly half of all American adults have LDL cholesterol levels above the optimal threshold, nearly half, and the updated 2026 guidelines from the American College of Cardiology and the American Heart Association have actually moved those thresholds downward, meaning that millions of people who were told their cholesterol was acceptable under the old guidelines are now in a range that the current evidence says warrants attention. Under the updated 2026 guidelines, ideal LDL levels are under 100 milligrams per deciliter for low-risk individuals, under 70 for those at higher risk, and under 55 for those at very high risk. Total cholesterol should ideally be below 150 milligrams per deciliter. Anything over 200 is borderline. Anything over 240 is high. If you do not know your numbers right now, this video ends with a specific recommendation about what to do about that. But if you do know your numbers and they are above any of those thresholds, what I am about to tell you about the next 30 days is the most important information you will hear today. By the time this video ends, you will understand exactly what LDL cholesterol actually does inside your arteries, and why the process is so dangerous, precisely because it is so silent. What the specific dietary changes that the research shows produce the most significant LDL reductions in the shortest time frame actually are. What the lifestyle changes beyond diet that the most current evidence supports for natural cholesterol management look like in practice. What the specific foods that most Americans eat regularly are actively raising their LDL right now, and how quickly removing them produces measurable change, and what a realistic 30-day plan looks like for someone with a real life, a real schedule, and a real reluctance to turn their entire lifestyle upside down. Stay with us until the very end, because the final section of this video contains the single most surprising cholesterol lowering finding from the research published in 2026, and it is the one that most people never expect to hear. Let us start with what cholesterol actually is, and what it actually does inside your arteries. Because the oversimplified version of this story, the one that says cholesterol bad, eat less fat, case closed, has left most Americans with a misunderstanding of the mechanism that makes managing it so much harder than it needs to be. Cholesterol is not a poison. It is a naturally produced substance that your body makes itself, and that performs essential functions, including the production of hormones, the building of cell membranes, and the production of bile acids that allow you to digest fat. Your liver produces approximately 70 to 80% of the cholesterol in your bloodstream. The remaining 20 to 30% comes from the food you eat. This is important because it means that dietary changes alone, while genuinely powerful, operate on a portion of the total cholesterol picture, rather than all of it. The reason high LDL cholesterol is dangerous is not about the cholesterol itself. It is about what happens when LDL particles accumulate in the walls of your arteries. When there are more LDL particles in the bloodstream than the body's clearance mechanisms can efficiently remove, those particles begin to penetrate the inner lining of the artery walls. The immune system recognizes them as foreign and sends inflammatory cells to deal with them. Those inflammatory cells absorb the LDL particles and become what researchers call foam cells. Foam cells accumulate inside the arterial wall and form the earliest stages of atherosclerotic plaque. As that plaque grows, it narrows the artery, it reduces blood flow, and in its most dangerous form, it becomes a vulnerable plaque with a thin fibrous cap that can rupture. When a plaque ruptures, the contents spill into the bloodstream and trigger the clotting cascade that causes a heart attack or stroke within minutes. That process, from the first LDL particle penetrating an artery wall to the plaque rupture that causes a heart attack, takes years or decades to complete. It is completely silent throughout. There is no pain, no warning, no symptom that tells you the process is underway. The only way to know it is happening is to check the numbers, and the only way to slow or reverse it is to address the conditions that allow it to proceed. Now here is what most people never find out about the cholesterol story. The research on what moves LDL numbers most significantly in the shortest time frame has become considerably more specific in the last 2 years, and the findings are more practical and more actionable than most people expect. The single most powerful dietary intervention for lowering LDL cholesterol is not reducing fat intake. It is not going vegan. It is increasing soluble fiber consumption. A review published in a major journal of medical research found that a high-fiber diet can lower LDL cholesterol levels and reduce the risk of heart disease by nearly 25%. 25%. From fiber alone. The mechanism is specific and elegant. Soluble fiber forms a gel-like substance in the digestive tract that binds to cholesterol before it can be absorbed into the bloodstream and carries it out of the body as waste. Every gram of soluble fiber you consume is actively removing cholesterol from your system, rather than allowing it to enter your blood and begin the arterial plaque process. The foods highest in soluble fiber that the research consistently identifies as the most effective for LDL reduction are oats and oat bran, beans and lentils, apples and pears, psyllium husk, barley, Brussels sprouts, and avocado. The research published in 2026 specifically identifies oats consumed at breakfast as producing particularly significant LDL reductions compared to consuming them at other times of day. The beta-glucan fiber in oats binds cholesterol in the gut and removes it from the body before absorption. Eating a bowl of plain oats with berries and a handful of nuts for breakfast is not a sacrifice. It is one of the most evidence-supported cardiovascular interventions available without a prescription, and it takes 5 minutes to prepare. Let me tell you about Jennifer. She was 49 years old, an accountant from Tennessee, who had been told at her annual physical that her LDL was at 138 milligrams per deciliter, well above the under 100 threshold for low-risk individuals under the 2026 guidelines. Her doctor had recommended lifestyle changes before considering medication and had given her a pamphlet that said eat less saturated fat and exercise more. Jennifer tried. She cut back on red meat, she avoided butter, and 3 months later her LDL had dropped by 4 points. 4. She was frustrated. She felt like she had made real changes, and the results had been almost invisible. What Jennifer did not know, and what nobody had explained to her, was that cutting saturated fat was only addressing one part of the LDL equation. When she actually began tracking her soluble fiber intake, she realized she was consuming barely 3 grams per Dalton Y. The recommended amount for LDL reduction is 10 to 25 grams. She was at 12% of the lower end of the target when she systematically increased her soluble fiber consumption over the following 30 days. Oats every morning, a serving of beans with lunch several days per week, an apple as her afternoon snack. Her LDL dropped by 22 points in 30 days, more than 5 times the reduction she had achieved in 3 months of cutting saturated fat alone. The second, most powerful dietary intervention for natural cholesterol reduction is one that surprises many people because it requires adding something rather than removing something. Plant sterols and stanols. These are naturally occurring compounds found in small amounts in many fruits, vegetables, nuts, and seeds that work by competing with cholesterol for absorption in the digestive tract. When plant sterols are present in the gut, they occupy the absorption sites that cholesterol would otherwise use, reducing the amount of cholesterol that makes it into the bloodstream. The research on plant sterols for LDL reduction is among the most consistent in nutrition science. Consuming 2 grams of plant sterols per Dalton Y reduces LDL cholesterol by an average of 10 to 15% in clinical trials. For someone with an LDL of 130, that represents a reduction of 13 to 20 points from a single dietary addition. Foods naturally high in plant sterols include nuts, particularly almonds and pistachios, vegetable oils, whole grains, and legumes. But here is something your doctor may not have had time to explain about plant sterols specifically. The timing of consumption matters. Plant sterols work most effectively when consumed with meals rather than between meals, because they need to be present in the digestive tract at the same time as dietary cholesterol to compete for absorption. Building plant sterol-rich foods into meals, rather than consuming them as isolated snacks, maximizes their LDL lowering effect. The third dietary intervention that the research supports as genuinely powerful for LDL reduction is the one that the low-fat dietary advice of previous decades actually worked against, replacing saturated fats not with refined carbohydrates, but with unsaturated fats. Particularly monounsaturated fats from sources like olive oil, avocado, and nuts, and polyunsaturated fats including omega-3 fatty acids from fatty fish like salmon, sardines, and mackerel. The research updated in 2026 is clear that the type of fat matters far more than the total amount of fat. Replacing saturated fat with unsaturated fat reduces LDL. Replacing saturated fat with refined carbohydrates does not reduce cardiovascular risk and may actually increase it by raising triglycerides and lowering HDL cholesterol. This is why the low-fat processed food revolution of the 1980s and 1990s, which replaced fat with sugar in thousands of products, did not produce the cardiovascular improvement its proponents predicted. It was solving the wrong part of the equation. Now let us talk about what you need to stop eating in the next 30 days, because removing the most potent LDL-raising foods from your regular diet produces changes that appear in blood work within weeks. The single most powerful LDL-raising dietary pattern is one that combines high saturated fat consumption with high refined carbohydrate consumption simultaneously. This combination drives LDL elevation through two independent mechanisms at the same time. Saturated fats reduce the liver's clearance of LDL from the bloodstream by downregulating LDL receptors, and refined carbohydrates drive triglyceride production and the formation of small dense LDL particles that are even more atherogenic than large LDL particles. The foods that most effectively combine both of these mechanisms in a single serving include commercially baked goods, fast food items prepared in low-quality fats, processed snack foods, and many packaged convenience foods. These are not the foods most people think of when they think about high cholesterol risk, but they are the foods that the most current research identifies as the most potent drivers of the LDL elevation and the small dense particle profile that poses the greatest cardiovascular risk. And this is where it gets really serious. Because beyond diet, there are two lifestyle factors that the research shows can produce meaningful LDL improvements within 30 days that most people underestimate dramatically. The first is physical activity, not marathon training, not hours of intense cardio, 30 minutes of moderate aerobic activity, defined as activity that raises your heart rate to a comfortable but elevated level. Most days of the week, a brisk walk, a bike ride, swimming, dancing. The research is consistent that regular moderate aerobic exercise raises HDL cholesterol, the protective kind, by 3 to 6% within weeks of beginning a consistent program. It improves the overall cholesterol profile by reducing triglycerides and shifting the LDL particle distribution toward larger, less dangerous particles. And it activates LDL receptors in the liver in ways that improve the body's own cholesterol clearance mechanisms. Let me tell you about David. He was 57 years old, a warehouse supervisor from Georgia who had total cholesterol of 231 and LDL of 154. He had not exercised regularly in 4 years. When his doctor recommended lifestyle changes before medication, David's first instinct was to focus entirely on what he ate. He made dietary changes for 3 weeks. Then his colleagues suggested they start walking together during their lunch break, 30 minutes every working day. Within 6 weeks, David's HDL had risen by 5 points, his triglycerides had dropped by 31 points, and his overall cholesterol profile, even before his LDL had moved dramatically, had shifted in a direction that his cardiologist described as genuinely meaningful progress. The exercise was not replacing the dietary changes, it was compounding them. Each intervention amplified the effect of the other. The second lifestyle factor that most people dramatically underestimate for cholesterol management is stress. Chronic psychological stress is associated with elevated LDL cholesterol, through multiple mechanisms. The stress hormone cortisol stimulates the liver to produce more LDL. It promotes inflammation in the blood vessel walls that accelerates the conversion of LDL into plaque. And it disrupts sleep, which is itself independently associated with elevated LDL and reduced HDL. Research published in 2025 found that people who reported high levels of chronic work stress had significantly worse cholesterol profiles than people with similar diets and activity levels who reported lower stress levels. The difference was not explained by dietary differences. It was explained by the direct physiological effects of chronic cortisol elevation on cholesterol metabolism. Managing stress, through whatever approaches work for you, is not separate from managing your cholesterol. It is one of the mechanisms through which your cholesterol is managed. Now here is the most surprising finding from the 2026 research that I promised you at the beginning of this video. And it is the one that most people never expect to hear from a cardiologist. Eggs. The conventional wisdom on eggs and cholesterol has been that, because eggs contain dietary cholesterol, they raise blood cholesterol and should be limited or avoided by people concerned about their cardiovascular health. The research published in 2026 has substantially revised that position. A study published in the American Journal of Clinical Nutrition found that healthy adults who ate 2 eggs per Dalton Y for 5 weeks, as part of a low-saturated fat diet, actually significantly lowered their LDL cholesterol. The explanation involves the fat composition of eggs. Eggs are relatively high in unsaturated fat, and relatively modest in saturated fat. When eggs replace foods higher in saturated fat in the diet, the net effect on LDL is often favorable rather than harmful. The research now supports the position that dietary cholesterol from eggs has far less impact on blood LDL levels than the saturated fat content of the overall diet. This does not mean eggs are a cholesterol-lowering superfood, but it does mean that the reflexive advice to avoid eggs entirely for cholesterol management is no longer supported by the most current evidence for most people. So what does a realistic 30-day plan actually look like? Week 1 focuses on adding soluble fiber oats at breakfast every day, a serving of beans or lentils at least 4 times per week, an apple or pear daily. These additions alone, applied consistently through week 1, begin the most powerful single dietary mechanism for LDL reduction. Week 2 adds the removal of the most potent LDL-raising foods, processed baked goods, and packaged snack foods, replaced with nuts, seeds, and fruit, commercially fried food replaced with home-prepared alternatives using olive oil. This week, the combination of more fiber and less saturated fat from processed sources begins to compound. Week 3 adds the physical activity component. 30-minute walks on at least 5 days of the week. This week, the HDL begins to rise, and the triglyceride profile begins to improve alongside the LDL changes already in progress. Week 4 adds the stress management and sleep consistency component. A consistent bedtime, a morning phone-free window, some form of daily stress reduction practice, and a check-in on all 4 components to assess what is working and where the most room for improvement remains. At the end of 30 days of consistent application of all 4 components, the research predicts meaningful improvements in LDL, HDL, and triglyceride levels for most people who apply them genuinely, not perfect numbers necessarily, not a replacement for medication in people for whom medication is indicated, but measurable, meaningful, clinically significant progress in the direction of a cardiovascular risk profile that is lower than where you started, and a foundation of habits that, sustained beyond 30 days, continue to compound in ways that your arteries will reflect for decades to come. If this video gave you a genuinely clearer and more complete understanding of what cholesterol actually does inside your arteries, what the updated 2026 guidelines say about where your numbers should be, and what a realistic 30-day plan for moving those numbers in the right direction actually looks like, subscribe to Dr. Amanda Clarke and turn on notifications so you never miss a video that matters for your health. And drop a comment below answering this question honestly. Do you know your current LDL number right now? And if you do, is it within the target range under the 2026 guidelines we discussed today? Every comment matters, and your honest answers help us understand what this community needs most.